Uganda is a vibrant country filled with energy, resilience and hope. But behind the daily rhythm of life, a silent disease continues to threaten families and communities. An airborne disease that spreads through the air when an infected person coughs or sneezes, a disease that is preventable and curable, yet still claims thousands of lives. According to the Ministry of Health, Uganda remains among the 30 high tuberculosis-burdened countries in the world. Each year, about 90,000 people in Uganda fall ill with TB. An estimated 96,000 people develop the disease annually, but not all are diagnosed in time. In fact, around 10,000 people with TB remain undetected each year, continuing the chain of transmission within communities. Approximately 11,000 Ugandans die from TB each year, despite the disease being preventable and treatable. For many families, TB brings lost income, stigma, and lost months of treatment. But there is hope. Across Uganda, scientists, clinicians, and health workers are joining forces to change the trajectory of tuberculosis. One of these initiatives is through the LIGHT Consortium. The LIGHT Consortium is a multi-country research partnership bringing together scientists, clinicians, and public health experts from Uganda, Kenya, Malawi, Nigeria, and the United Kingdom to strengthen the fight against tuberculosis. By combining research, clinical expertise, and global collaboration, the consortium is working to improve how TB is detected, treated, and managed, particularly in high-burden settings. Through research and partnerships, the LIGHT Consortium is working to address some of the most urgent challenges in TB control.
The main aim of the LIGHT project was to study the contribution of gender in TB care cascade, in risk for TB, in access to care, the whole cascade from diagnosis, treatment, and follow-up. Basically, that's why we put the word gendered pathways of TB care. How does gender affect TB care with a focus on men? Because at that time, many countries had completed TB prevalence surveys, and we had seen that actually up to almost 60% of TB patients were men, and we wanted to understand what were the drivers which perpetuate the high risk of TB among its men.
The LIGHT TB project is one of the best things that has ever happened if you speak about TB programming, not just in Uganda, but globally. The LIGHT TB project is a response to the gaps we saw in terms of gender and how it affects TB programming. And under the LIGHT TB project, we've been fronting the message that we need to interrogate the data. The data we see is informed by many things, but gender is one thing that is very key. So working with our partners in Europe, that's the LSTM, in Africa, Nigeria, Kenya, Malawi, and of course Uganda, we've tried out a series of interventions that could improve TB programming with a keen eye on gender.
Tuberculosis continues to affect many communities in Uganda. Research initiatives like the LIGHT Consortium help us identify ways to diagnose and treat patients earlier. Tuberculosis may still be one of the world's deadliest infectious diseases, but through science, collaboration, and innovation, a different future is possible. Through initiatives like the LIGHT Consortium, Uganda is taking important steps towards a world free of tuberculosis.
Over the years, we've worked with Makerere Lung Institute, MLI in short, in many ways. But of course, along the ways, we encountered the LIGHT Consortium, which is working with Makerere Lung Institute, with which we have had a number of research projects that have influenced the way we work in the TB program. One of the things that we have done is working with the TB survivors, and we looked at the challenges and the capacity needs for developing the TB survivors. We think this is going to help very much in how we understand the challenges that the TB survivors go through even after treatment.
The The LIGHT Consortium is making meaningful contribution to Uganda's fight against tuberculosis by strengthening research, training the next generation of scientists, and supporting national TB control efforts. Working closely with Uganda's National Tuberculosis and Leprosy Program, the consortium is generating evidence that helps inform policies and improve patient care across the country.
We have been able to look at issues that have concerned the policy in terms of the vulnerable populations that we have in TB, and we have been able to map where these vulnerable populations are. We support and work with the LIGHT Consortium and Makerere Institute.
Through its capacity building initiatives, LIGHT has also supported early career researchers, including Ugandan scientists who have successfully completed their PhDs, equipping them with the skills needed to lead future TB research. Beyond the laboratories and clinics, this investment in science, partnerships and the people is helping Uganda build a stronger, more sustainable response to tuberculosis.
Under the LIGHT Consortium, I got the opportunity to be a PhD student, and as part of this, I got the opportunity to really participate in the design and evaluation of a study, right from its initial stages, developing a concept, choosing appropriate study methods to evaluate it, and to the final implementation and evaluation. This has been a very, very unique opportunity for me to develop my skills that will lead me to become an independent researcher in various fields, health economics, implementation research, and all of this has been possible through the LIGHT Consortium.
The project came at the right time to address issues of men. We have been able to conduct some research which really has given us some insights to bring out all issues affecting male, and also guide us on programming. As we are now going to start to implement a new strategy, all research which have been conducted by LIGHT, data and even other programs which has come out, we have been able to use the results they have been able to come with to guide the new implementation plan strategy, which we are going to start implementing.
6 years later, the LIGHT Consortium and the Lung Institute has generated critical evidence to inform TB care, strengthen diagnostic approaches, and support national decision-making. The project has also invested in people, supporting early career researchers and training Ugandan scientists, including those who have successfully completed their PhDs and are now contributing to the country's growing research leadership. Beyond research outputs, LIGHT has helped strengthen collaboration between scientists, clinicians and policymakers, ensuring that evidence produced in Uganda continues to inform better TB control and improve patients' outcomes.
I think the LIGHT project has gone very well. It's one of the most successful consortia I've participated in. We have achieved most of the things we wanted to achieve. Basically, there were mainly like three main arms of LIGHT. There were work going on to look at the impact of gender on TB in the community, in the health facilities, and that's actually what JASPA has been doing, but also adolescent TB and young boys.
One of the things we've been doing under the LIGHT TB project is capacity building, and through this, one of the PhD students has been able to design, implement interventions that could potentially improve TB programming, especially TB in men, and these have all been shown actually to work. And now as LIGHT, what we need to do is how then do we make sure these interventions are rolled up, which now brings me to the point of research uptake and policy engagement. And as the program, we've been doing that, all in the bid that these interventions could be rolled out as one way of improving TB programming.
We worked with TB survivors in Kawolo and in Nakawa, and they have been trained on photo voice methodology, so they got cameras and were trained to take pictures to document their experience as TB survivors in Uganda. They did that for 2 weeks, and then they shared their stories through photos and we disseminated them both in Kawolo as well as in Nakawa, and then here also at the national level. The impact, I would say, is a deeper understanding of TB survivors' experiences, both of the challenges they face, the compassion they have for their communities and for other people with TB, and also their capacity. They do not sit down. They recognize people in their communities who have persistent cough, and they refer them to testing. They will even go as far as giving transport support. They also talk to their fellow women in women's groups or to fellow men at the workplaces to share knowledge about tuberculosis.
We particularly focused on men attending urban public health facilities, and what we found is that there are several gendered barriers that men face in accessing care. We were able to engage various policymakers, healthcare workers, people who have suffered from TB, and co-create solutions or a specific intervention care package that we implemented in 2 intervention facilities, Gombe and Mityana Hospital, and we were able to compare this before and after the intervention and with 2 other facilities that did not implement this intervention. And what we saw was that this intervention, which included extended working hours, integration of TB screening with HIV screening, diabetes and hypertension, and engaging male champions who would give health education to men. Additionally, we distributed educational materials within the communities and healthcare facilities, and we ensured that everybody who came to these intervention facilities was screened for TB.
New things I basically learned, one is how to find evidence. So we learned about the use of the different search engines like the Google, Scholar, PubMed, and the other different search engines, which we have not been routinely using in our day-to-day work, but through this training we're able to know how to access information and then use the different search engines to be able to identify what is relevant for our work. And then we're also able to learn how to appraise evidence. So there are tools that we learned that we use to look at published literature and also grey literature, and then appraise it so that we're able to pick what are the key issues, and then the evidence which is basically used to inform what policy maybe you want to come up with regarding a particular intervention. For my case, one of the policies that we try to come up with is on improving community engagement, basically to find TB cases through community case finding. And through this training, we were able to review the different literature out there and also appraise the evidence, and came up with the recommendations which now is guiding us in our implementation. One of the things we looked at is if we want to impact on the TB incidence, we need to implement targeted interventions in communities that are at high risk for tuberculosis.
One of the greatest achievements for the project has been community engagement. Community engagement and the beneficiaries engagement. I have had an opportunity and chance to interact with beneficiaries, and it's very impressive to see how empowered they are, how engaged they have been.
What is needed is to shift our perception of TB survivors away from seeing them solely as victims, but also seeing their capacity and what they are actually already doing. Involving them more as partners, recognizing their strengths, and listening to what they need as TB survivor networks to function well. And I think that's a next step for us to think about the networks that already exist, the recommendations that we have in the terms of the roles that TB survivors can play. How can we support and work with TB survivor networks to ensure they can play these roles effectively in the community.
So we keep improving continuously through the implementation research, because we are able to detect our gaps, and when we use the research to look at interventions that we think can address those gaps as we move forward, and we find out which actually works and which does not work. So the ones that work, then we scale them up. They inform the program, and we scale them up to improve on our indicators within the program. So we value operational research and the support we are getting from Makerere Institute and the LIGHT Consortium.
As this chapter of LIGHT Consortium comes to a close, its legacy extends far beyond the life of the project. This has strengthened the foundation for tuberculosis research and response in Uganda and beyond. While the project may conclude, the partnerships built, the knowledge generated, and the commitment to ending tuberculosis will continue to guide the journey toward a healthier future.